Hey everybody, it's Wayne coming to you live from Power, and today we will be talking about social distancing. What we'll be discussing today is what social distancing is, what it is not, the pros and cons of social distancing, why it's important, and what to do if you guys are feeling sick. So, what is social distancing? I'm going to give you the definition from Webster Dictionary. Social distancing is the practice of maintaining a greater than usual physical distance, recommended 6 feet, from other people or of avoiding direct contact with people or objects in public places during the outbreak of a contagious disease in order to minimize exposure and reduce transmission of the infection. So basically, you guys, we're just supposed to keep our distance away from people. Like they said, it's a recommended 6 feet. 6 feet. If you guys really want to know, you could just place your foot, one foot in front of the other. That's 2 feet, 3 feet, 4 feet, 5 feet, 6 feet. So a lot of grocery stores, a lot of public places that are still open, essential places, have markers. They either have a tape line or they'll have a sign that states that it's 6 feet between. So try to keep that space. If not, make the barrier yourself. You don't even need the tape. Just know to try to stay 6 feet in between people. Um, so examples of social distancing, they have given examples of like working from home instead of coming into the office. If you have a congested office, here there's only 3 of us. We all have our own offices, so we're still pretty separate. We are more than 6 feet apart. This is for people who work in cubicles and a lot of people who work in large space offices with like a lot of people, probably like 10 or more individuals as of right now, because it can't be any gatherings larger than 10 people. Closing schools and switching to online virtual classes, or closing classes for the rest of the year. A lot of places around, I don't believe there's any schools open at the moment. I think there's only one college open, which is getting a lot of lashback as well, because it is not practicing social distancing, especially in the pandemic that we're in now. So like I was saying, switching from inside schooling to virtual schooling, or postponing the school year. Visits via electronic devices instead of in person. So a lot of people have been doing FaceTiming, group chatting, different apps that they can speak to their friends with. They've been hosting, instead of having meetings, people have been hosting conference calls. People have been doing Zoom calls. They've been using, like I said, different apps, so they could either host their meetings and their conferences still, and just not in person. Parties have been getting postponed and canceled, or they've been doing virtual parties. I know a lot of people have been having virtual parties. We had a virtual party for one of my friends. We actually just all downloaded Zoom. We all had our own thing going on in our own little frame, and we were just enjoying each other via electronic devices. So, yeah. What is not social distancing? Quarantine parties are not social distancing. A lot of people have been having quarantine parties like, oh, the clubs are closed, everything's closed, everyone come to my house. And even the 6 people, there has been a reported, there was someone who threw someone a 50-year-old birthday party. It was 6 individuals at the birthday party. 5 of them caught corona, and I want to say at least 3 have passed from it. So a lot of people are like, oh, it's only 6. It's the recommended number. We're not exceeding the number of people for the gatherings, and the corona is still being passed. So if you can, do not have any quarantine parties. Cancel them all together. Doesn't matter the number of the party. Quarantine challenges that are closer than 6 feet. So a lot of people have been doing TikTok, Thriller, different things like that. Like I said, they've been using apps, but they've been creating challenges. A lot of people are doing these challenges with their family. They're right up on them. I understand that you say, oh, it's just my family, or oh, it's just my friends. But like I said, no one can tell. No one knows who's the carrier of the virus. People who have, is it asymptomatic? That means that people who are not having symptoms are still able to pass the virus. So you may not have any symptoms, you're still able to pass the virus, which is why it's important to still keep that 6 foot distance. And I know it may be hard with people who live in apartments, but if you have the space, please try to keep that 6 feet distance, no matter if it's boyfriends, girlfriends. Oprah and Stedman are having social distancing. Oprah has him in the guest house. I don't recommend you guys putting your man or your woman in the guest house. However, if you have that luxury, go ahead. But like I said, try to still keep that distance when doing the challenges. Stand 6 feet apart, like I was saying. Stick your arm out. Make sure nobody's in an arm length from you. Stick your arm forward. Make sure you're not following them up. Boom, 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 boom. All up on them. Give them some space. Give them not 50 feet, but at least 6. All right. So, any unnecessary traveling. I know air flight is cheap right now. Tickets are extremely low. You guys want to live to share this experience that you're trying to have. Stay home. Traveling is one of the largest, quickest, easiest ways to spread the virus, to contract the virus. Stay home. Like, oh, I have my gloves, I have my mask, I'm airport ready. Stay home, people. Please stay home. Stay home, stay home, stay home. Anything and chill. If you're chilling with somebody, that's not social distancing. Don't Netflix and chill. Don't cook and chill. Don't bake and chill. Don't nothing and chill. If you're not doing a solo dolo chill session, don't chill. Not social distancing. So, you say, okay, so y'all, I probably should have been pointing at this stuff. We are on to the next page. My lovely coworker Lonnie wrote this on my last video. It's on our live. It's posted on our live on Instagram. So, we already talked about what is not social distance. We're now at the pros and cons. So here are our pros of social distancing. What's the pros? It significantly lowers the chances of becoming infected and infecting others, which is the main reason of social distancing. We want to get a control of the virus. We want to flatten the curve. And the only way to flatten the curve is to lower the chances of infecting people or becoming infected. And what is a better way than social distancing or staying home? Stay home, stay home, stay home. I cannot stress that enough. Please stay home. I will also clarify this curfew rule, which is not a curfew, it's a stay-at-home order. I will clarify that at the end of the video. But it slows down another pro of social distancing is it slows down and decreases the transmission of the virus. So, slowing the transmission and decreasing this transmission is flattening the curve, which will eventually wipe the virus out. We won't have to worry about it. It controls the outbreak. We want to get a control on the outbreak. We have our numbers are tripling, quadrupling by the days. Like, they're getting out of hand. It's numbers that you never expected, that the worst of the worst expected. And it's still growing. And the only way we can do our part is to make sure that we're doing our part, staying home. So, you say, well, what are the cons of social distancing? Loss of school days. Teachers, a lot of kids have to go home. They don't, so now that's making parents have to find childcare. That's it's not allowing them to finish their studies. A lot of people have to graduate. There's a lot of graduates this year. There's a lot of people who have finals and stuff. They have to find alternative ways of schooling, which can become difficult. However, they have been combating it. I know a lot of schools are handing out laptops. A lot of places are providing, a lot of different companies are providing free Wi-Fi for school-age students. And they have switched a lot of schools have switched to online schooling, or they're postponing the curriculum. Lost days of work. So if you're not an essential worker, a lot of you have been hit with this. So I know that a lot of people are getting temporary layoffs. The unemployment rate, they filed for unemployment. It was 3.3 million people filed for unemployment this week. from last week. So there's a huge loss of jobs right now. So that's our economy. That's everything. However, I do know that if you guys are looking for a job, distribution centers are hiring. Amazon distribution centers, Walmart distribution centers, all the grocery stores are hiring. Anywhere that you could think of as an essential worker is basically hiring right now because they are definitely in dire need. So if you are looking for a job and you do need more income, or you do need income and you're not able to receive that income right now, please try to look in somewhere in that field. Like I was saying, layoffs, temporary layoffs, and some of them are permanent layoffs. So that is definitely not a good thing. And like I was telling you, I did list a couple of options of jobs that you guys can look for. Anything essential, just think of that when you guys are applying, because that's what is hiring, and that's the only thing that's open right now. So when you think about that, and like when I say essential, everyone like, oh, these are fast food restaurants as well are open. You can't do, they're not doing sit-ins, but you can do carry out, and drive-through is open. So these are jobs that people don't look at, but these are jobs that people don't necessarily value, but they should be valued, because at a time like these are the only workers who are able to assist you, and they're the only people who are still, like I said, still able to go to work and get a check. So remember, when you guys are out shopping, you do run into essential workers, remember to thank them, and remember to be polite, and to remember that they have had a frustrated day, that all essential workers are being bombarded right now. They have a lot on their plate right now. Remember that when dealing with them, and try to be patient as well, because things are a little hectic at the moment. So we talked about the pros and cons. So what is important? Why is social distancing important? We've mentioned that a couple of times during this video. The number one reason it is important, it is because with COVID-19, it can be impossible to know if you're infected and possibly infecting others. Everyone infected does not show symptoms and could feel normal and healthy, but in actuality could be infecting hundreds of others people. So I'm going to give you an analogy of that case. Give me 1 second. I should have pulled this up. Alright, so I'm going to give you an analogy. So, Karen was infected yesterday, but won't know till 14 days later. You got that in mind? Karen was affected yesterday, but won't know till 14 days later. I'm going to write it for you, okay? So y'all get a better understanding of what I'm saying. This is Karen. Can you see? That's Karen. She was infected yesterday. She won't know for 14 days. It says Karen thinks she's healthy and isn't infecting 10 people every day. So, that's little Karen. Monday, Karen has infected 10 people. Tuesday, Karen has infected 10 people. Wednesday, Karen has infected 10 people. Thursday, 10 people. Friday, 10 people. Saturday, 10 more. Sunday, 10 more. Now, it says that Karen does not know for 14 days, right? So that means for 14 days straight, Karen has infected 10 people a day. If you multiply 10 times 14, we're going to do another week, right? Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. 10, 10, 10, 10, 10, 10, 10. That's 14 days. 10 people each day. Do 14 times 10. That's 140 people that Karen has infected. One person in 14 days has infected 140 people. Now, these 10 people think they're okay and go out and infect 100 people. You get it? Boom. So, that is 10 people. So, they're infected 100 people. So, every 10 people is infecting 100 people. 140 people. You're going to have to multiply that by 10 to see how many people that has infected. Those 140 people, guess how many people they have infected? 1,400 people have been infected from one person, one contact person. We're not even talking about now multiplying all these other people. It says these people then think that they're those 100 people think that they're healthy. The 100 people that they infected think that they're healthy and go out and infect another 1,000 people, right? So, long story short, I don't really feel like doing the math right now. I could do the math, y'all. I'm a math major. Don't get it confused. Business management, Howard University. Ran it up. However, I don't feel like doing the math right now, but y'all get it. Y'all get the gist. 100 more people infected. Keep multiplying all these numbers. You're getting to numbers on top of numbers. Thousands of people from one person. One person can infect thousands of people in the matter of 2 weeks. And each person, those thousands of people, they're infecting thousands and thousands of people, which comes hundreds of thousands of people, which is why we are now, I think we hit 1 million people infected worldwide of the coronavirus today. That's not to scare you guys. That's just to show you how important it is to social distance and to stay home, and how quick and easy and simple it is to infect people without even knowing. And then you have the issue that we have now. So, what do you do if you feel sick? Well, you say, well, what are the symptoms of feeling sick? I'm gonna hang this back up for y'all. What do you do if you feel sick? First of all, you would have to know what the symptoms are of feeling sick. So, the reported symptoms are sore throat, fever, chills, sneezing, coughing. Kia, can you think of anything? The symptoms?
No, I think you said them all.
I do believe I said them all. So, those are your symptoms. If you're having any of those symptoms or multiple symptoms, do not, whatever you do, don't go to the hospital. My apologies. Whatever you do, do not walk into a clinic. Do not walk into your doctor's office. If you're having any of those symptoms, you need to call that clinic or call the doctor's office before you come. The main reason you need to do that is because, number one, you do not know if they are even providing COVID testing. And if they're not providing COVID testing, you will be quarantined. Once you walk in, they're going to have to quarantine you until someone is available to then deal with you, transport you to somewhere that is doing testing, and they'll have to handle it from there. So you could save yourself as well as that facility a long, drawn-out process by calling just to make sure, and they'll let you know where to go and how to handle it. So like I said, make sure you call first. Now, if you cannot call and you have to absolutely walk in, please try to go into a hospital. Hospitals are better equipped to deal with things like this because they're for emergencies. This is an emergency. This is not something that the average person can deal with or the average clinic or facility can deal with. So please do not just walk in. Please, please, please call, because a lot of places are not even taking walk-ins if you do come. So you could waste your time by doing that, and we don't want to do that because time is very valuable and precious. So, like I was saying, if you do have any symptoms, the first thing you should do is to stay home, self-quarantine. So, continue to wash your hands. Everyone needs to be washing their hands constantly. Wash your hands when coming outside. Wash your hands before going outside. Wash your hands when coming in from outside. Wash your hands before you eat. Do not touch your face. Do not touch your mouth. Do not touch your nose. Keep your hands away from your face. Definitely wash your hands. Wash your hands. Wash your hands. Wash your hands. Why? Because the virus, the soap keeps the virus away from you. Kills the virus off of you. Just know that. The soap will kill the virus off of you and will keep it away from you. Wash your hands. Hand sanitizer is only effective if it has more than 60% alcohol in it. However, try to stem away from hand sanitizer because overuse of hand sanitizer makes the hand sanitizer not work, if that makes sense. So if you overuse your hand sanitizer, it defeats the purpose and it's not working. So wash. Stay home if you're having any symptoms. Self-quarantine, 14 days. Monitor your symptoms. If your symptoms are not going away or they are getting better, or they're not getting better, please contact a physician. Let them know. Like I said, monitor your symptoms so that you can let them know what's going on, how long it's been going on, and everything, because the more information you have is the better for them to be able to assist you. Do not, if you guys are wearing gloves, please make sure you're throwing away your gloves. You're not wearing the same gloves all day, because I want you to know that if you do so happen to wear those gloves, you're wearing them to protect yourself. You can harm yourself, because you know why? If I was to wear my gloves all day and the first thing I did was touch Corona that morning, and COVID, if I touched that morning on that glove, everything else I've touched have now infected. So a lot of people are going in their pockets, they're going in their purses, they're picking up their cell phones with their gloves, they're talking on their phones, not knowing that you're touching your glove and you're putting that on your face. You're touching your keys, you're putting that on the door, you're touching your door handles, you're going in your house, you're putting your keys in your purse. That's now inside. You don't hand sanitize inside of your purse. You have to remember that you're touching your steering wheel, you're touching everything with these gloves, you're infecting everything with the COVID. But you're trying to protect yourself, so just try to remember to please get rid of those gloves. Don't wear them all day. Swap them out. I don't know how often to swap them out, but please try to swap them out. I say every couple of hours, if you ask me. I honestly switch gloves, but I only do it because I'm a physician and I have the gloves to do it. After every use, every different thing. When I switch rooms, I switch gloves. When I switch patients, I switch gloves. When I switch different work that I'm handling, I switch gloves. When I go into the vehicle, I switch gloves. When I come out of the vehicle and go into a different facility, I'm switching gloves. Face mask the same way. You guys are putting on face masks. You're taking the face mask off. You're putting it on your chin. All of that is still sitting in the area of your mouth and your nose. You're taking the face mask off, touching your face, but you just touched the face mask that touched your face. And then touched your face. So you guys have to realize that you guys could be contaminating yourself by trying to protect yourself. So the best thing to do is to just please be mindful when you guys are wearing masks and gloves that you guys are not reusing and that you're throwing them away. You're not bringing them into your home where your kids are. Throw them away outside. Wash your hands when you get inside if you must. But please don't bring them into your home. Please don't lay them around. Please don't save them for later. Because I know a lot of people have face masks and have been saving them. I know some people have been spraying Lysol on them. Throw them away, people. Please throw them away, because you could be harming yourself instead of actually helping yourself. So, like I was saying, constantly change gloves. If you have a fever or anything, please go to the hospital. Any coughs, any chest pains, that's what it was. Chest pains is another symptom. They said it feels like you're drowning in your sleep is another symptom. Problem of breathing is another symptom. Why? Because this is a respiratory. It's attacking the respiratory system. This virus is. So you guys, please, do not share towels. Do not share face cloths. Wash those as much as often. Do not share food. Do not share drinks. You guys should be social distancing anyway. But please don't be sharing anything like that. No visitors, no new people. If you guys must hang with someone, don't hang with anyone. FaceTime them, like I said. If you have to sneeze and you have to cough into your elbow, sneeze into your elbow. If you don't cough into your hand, don't sneeze into your hand. Why? Because you touch too many things. You may not have a towel right now. You may not have a napkin right now. You do have to cough. You do have to sneeze. It's better to sneeze into your arm and your elbow. You're less likely to. Nobody's touching your elbows. You're not touching that. You don't have to do anything with that. Don't sneeze in your hands. Don't touch your face. Wash your hands for 20 seconds. soap and water. No sharing dishes, like I was saying. If you're at home, and you, like I said, change your bedding. If you guys can, keep your own cup for the week. Keep your own fork for the week. Know what's yours. So like I said, you're not sharing. Clean all high surfaces in your everyday. We are spraying the office down with Lysol. We have Lysol wipes for wiping down surfaces after we get done using them. When I'm done for the day, I wipe off my entire desk. I'm wiping off my phone I've touched. I'm wiping off the computer I've touched. I'm wiping off even power buttons I've touched. I'm wiping off everything. You guys can use any type of disinfectant product. That's bleach, ammonia, 409, Fabuloso, Pine Sol, Lysol spray, Clorox. Anything that is a disinfectant cleaner you can use in your home to clean and disinfect the home. If you have traveled anywhere outside of the United States, or you have traveled to other states, if you have traveled anywhere outside of the United States, you should self-quarantine. That's for one, for 14 days. If you're not able to do that, do it to the best of your ability. If you have if you're leaving a country who has confirmed cases or is at a high risk of contracting COVID, please let someone know so they can give you best advice on what to do. As far as employers, as far as people you're living with, people you're coming in contact with should know who you've come in contact with, because like I said, you want to protect yourself and you want to protect them. Monitor who you've come in contact with when you come in contact with them, so you do know what's going on. I don't think that I'm forgetting anything. Kia, do you think I'm forgetting anything? Okay, so now to clarify this, if you're going out of the state, now DC, Maryland, Virginia, definitely say that if you're going, no unnecessary travels. But if you are traveling, you have to travel. If you're going out of the state, you should be self-quarantining when you come back in. They said it does not matter what state you're going to. If you're leaving out of the state and you come back into the state, you should be self-quarantining when you do come back. So Maryland, DC, and Virginia all went into the same type of band. There's no curfew. Everyone thinks they have an 8 p.m. curfew. There's no curfew. Monday, we went into a stay-at-home order. A stay-at-home order states that we are not to leave our home unless for essential purposes only. You guys may check your local, you can check Google for your essential, what's considered essential to your city and your state. I know in the DMV area, essentials are grocery stores, doctors, hospitals, liquor stores, hardware stores. Those are all essentials. Social work is essentials. Those are the only essentials, I believe. So if you're not going there, you shouldn't be leaving. It's not like, a lot of people have it confused that, we have to be in by 8 p.m. every day. No, it's not a curfew. A lot of places do have curfews. But in the DMV area, we have a stay-at-home order. We are not supposed to be out. It does not matter the time of the day if you are not out for essentials. So please stay there. You guys, there is up to 90 days in jail and up to $5,000 in fines if you are caught outside that window of essentials. Just hanging out, just walking, doing whatever you're doing. Do not get caught doing that. Stay home. It's not serious. You don't want to be stuck in jail during a quarantine. You don't want to be stuck in jail during a pandemic. Because if you're stuck in jail and you catch corona, it's the same type of isolation. Instead, you will be in jail. So, let's all get back to normal as fast as we can. And the only way we can do that is by doing our part and staying home. And I want to thank you guys for tuning in today and listening to me and my lesson on social distancing. And please be sure to look out for our videos. We will be sending them out at least once a week. So we really appreciate it, and we're happy that we can serve our community. And you guys have a great weekend.